less than 1, but usually up to 8 years, usually. And even then, this doc right here would wait a few years for it to be on the market because you just never know. So I waited. Bixero came out on the market. I didn't put it in my office right away. I waited a few years to wait and see what the safety and efficacy was. Same thing with other things. I just waited. How many people buy a car in the first year that it's put out off the press, right? Like almost nobody. Well, there's a few of you, but not too many, right? Most of us wait to see if that new version really pans out. Why not with this vaccine? This is what just boggles my mind. I just don't understand. It's not a vaccine. Let's be very, very clear. So risk versus benefit is not apparent. Even if you look at the cold, hard, just regular numbers, you don't have to be a statistician, you don't have to be a doctor to understand this. If you look at the rough numbers, because I like to look at things just like, I talk to people like, to make you understand as if we were in kindergarten. Like this is real basic. I try to stay real basic and not complicate things, but the rough numbers showed very early, even Pfizer's own data, to me, I'm looking at it, I'm like, there is no efficacy. Where are they getting this 95% thing? I don't get it. I don't get it. And I saw through that immediately. Now, let me tell you, I'm a pediatrician, I'm a clinician. I see 20 to 25 patients per day on a not so busy day. And I don't read journals a lot. Skim things, right? In the last year and a half, every single physician in this room probably read more journals in the last year and a half than they have in their entire career. It's a true statement. So let me tell you something, pediatricians are even worse. So, but I dug because I'm an advocate for children. I wanted to make sure things were safe. I wanted these kids that if someone walked in my office, if a child walked in my office sick with this virus, I wanted to be armed to the teeth to treat that patient to the best of my ability so that that kid grew up to its full potential. That's just me. Doing nothing is doing harm. I could not understand it. My brain could not wrap around how doctors could be okay with locking their doors to their patients, not answering the phone. So this pediatrician ended up being a geriatrician. And so I opened the doors to anyone that knocked. Because in my core being, I said, I have to treat you because that's what we do. That's what I signed up for. That's why I'm a doctor. You know, when I'm seeing informed consent being disregarded, patient-physician relationships being destroyed, this is horrible. This is a nightmare. This is not medicine. People under 25 years of age have a mortality rate of 0.55%. That's like nothing. Under 25, nothing. Adverse events from COVID-19 in young people under 20, Adverse events from COVID-19 in young people under 25 years of age. These are just some of the things that I'm hearing anecdotally. I don't have to look at VARs. I'm hearing this in my community. Unusual neurologic events, myoclonia, seizures, movement disorders, blood clots. One of my moms, I took care of her 3 kids. One of my moms, her father called me. She was in the ICU. She coded in the ICU. She's 37 years old. She decided to go out and get this vaccine. She coded. That's not normal. She had 3 children. We would have known she had a bleeding disorder. This is not normal, people. You're hearing this all the time. Myocarditis and pericarditis in children. This one makes my skin crawl. It has been reported that over 2,400 usually males, young males, have had myocarditis and pericarditis. And when you're listening to the ACIP, which is the Committee for Immunization Practices, these people poo-pooed this. They said, oh, it's mild. 561 kids under the age of 19 are now dealing with heart disease that never had a heart condition or health issue before, and it's directly related to this genetically nightmare vaccine. This is lifelong consequence. This is not mild. And for these people to sit around and talk to each other and joke around, one of the doctors didn't even stay for the entire conference who's on the committee because he had patients to see. He didn't even cancel the day of his patient because for this big emergency meeting, it wasn't important enough. He got up and walked out. And I don't understand why we're standing for this. You know, it exceeds the CDC and FDA thresholds. Look at what Dr. Cole presented earlier. Shelley Cole showed you. That was a single-digit threshold, and now we're in triple digits, and they're not doing anything about it. Future health risks: cancer, fertility, autoimmune disease, respiratory issues, cardiovascular disease. All this stuff exceeds the thresholds. Is there any harm in waiting? I think not. Thank you very much.